say all three of you have faced this disease at different times and different stage. And the most important thing is in the past, even in US when I was practicing, a lot of people would not come forward to talk about. And part of the problem why there was not good awareness in this month of October, I just want to say is because people just read only some stories which are negative stories about cancer. Because people who did well, like you three, never came out and spoke in public. Because sometimes it would be because of your position, like you are in a civil service, you are a professor, you are doing some business work. So you don't want to be known because people felt there was something attached to cancer that would become negative. But what you have shown very clearly, and lot people like you, is that by coming out and talking, I think all of you on this October are sending a strong message to everybody, all women in this world, not just in India but the world, that we should not fear cancer. And I myself, in my 45 years, have seen patients who have more work. It's a remarkable story, and I think hopefully we will write more about it, Professor Indra, on that. And so when people come and say the doctor told me I was stage 4, stage 3, what should I do? Should I take treatment? What should I always give your example and people like that, like how you can lead a normal life, and in proper treatment first time can make a big difference. And coming to Vandana, I think what you have shared, and you have been a great positive person. You did a lot more work, and it's a remarkable story. And I think hopefully we will write more about it, Professor Indra, on that. And so when people come and say the doctor told me I was stage 4, stage 3, what should I do? Should I take treatment? I always give your example and people like that, like how you can lead a normal life, and in proper treatment first time can make a big difference.
Immediately after I finished my treatment,
Whole thing, and I think you are the person changing the face of cancer care. People like you who there, and you are there in our clinic every day, and maybe you can share your experience with what is it you work in our clinics as a Pink Hope volunteer. Can you share your experience dealing with
uh,
young people, older people with different cancers?
yes, doctor. This was, I think, immediately after I finished my treatment. Um, I remember you saying that, you actually need some support group and everything. I said, yes, that is very important. We have our family with us. That's all. But then when we met and we spoke, we said that, besides the family, you need to have somebody to talk to you who's gone through the treatment, and who else can be better than that? So we said, yes, definitely. So we said, okay, let's form a small group. And this is how we formed our support group, and we called it the Pink Hope Support Group. Pink is, of course, it identifies the pink ribbon, the breast cancer, this thing. And support is what we talk about, what we have undergone, the problems that we had. We share it with the patients whom we meet over there. They are either newly diagnosed or they're taking the treatment, and they all have that fear whether how successful will they be after they finish their treatment. And so we are here, in fact, to talk to them, to tell them, and to show them that, we are back onto our normal lives. And that is a new normal. And as I said, it's a bigger jump for us. So, let's not fear it. Take the treatment, go ahead, and not have that negative attitude. So when they meet us, they ask me, ma'am, did you undergo chemo? I said, yes. When was this? So it depends. When I meet them, I tell them either it's 5 years, 6 years, 7 years. So they said, really? I can't believe that. I said, see, this is the treatment, and believe me, please do not have any alternate treatment. take your treatment, what it is, what your doctor tells you, go through it perfectly. And after that, you will be back on the road. So that is what we try to tell the patients, that do not stop your treatment. Don't get scared, that chemo has a lot of side effects. Yes, we agree, you do. But when we share that, we tell them, yes, what you are going through, even I've gone through the same thing. But that it was during that time. After that, I've been normal, absolutely. So when they listen to us, they say, oh my God, that's wonderful. And believe me, doctor, we have patients coming back. They're not patients, they're survivors now and thrivers like we are. And we connect with each other still. And any sort of problem which we have, we talk on the phone. Even during this lockdown, we do have people who talk to us, and the moment they hear our voice, I tell them, hi, how are you? And that thing, the moment we speak to them, it gets connected. So I feel this Pink Hope support group that we have formed, it actually began with 5 ladies who had undergone the same treatment. So we said our common goal is to talk to each other and then to talk to the patients who are taking the treatment. So I think this has definitely bringing in a lot of good support to the patients who are taking the treatment.
Vandana, I think one of the things I feel what your group has contributed is really, I call you like a patient advocate. Not only are you counseling the patients, but you are also fighting for the rights of the patient in the hospital, because, there are issues which always come up between the patients, administrator, the doctor. It could be, financial issues. It could be communication issues. So I think the Pink Hope group is something I feel this October message is there has to be a person, a group who understands the patient viewpoint and understands what they are looking for, understands their emotional status, and helps to counsel them to this. You have hold their hand. It's a key role played by volunteers like you, and what you have done in Bangalore is remarkable. And similarly, coming to Kirti, you being a doctor, and I think when you had the disease, and then 2007, you had a young child, still a daughter. What was, how important is the approach? We call it the positive attitude, taking it on, dealing with your family, child, husband. How important was it for you to be positive, and what is the message you would like to send in October? This awareness time to all the people who are young, who may have young children, because we come across people in their 20s, 30s with the breast cancer, and have number of questions, and they fear about their children. I remember myself, in 1979, when I saw my first patient in US, Mary. She had just two kids who were, one of them was like 2 years old, and and she's supposed to have inflammatory carcinoma. Her question to me was, will I see my children grow and get married? Fortunately, we did a lot of work with her. Not only she saw her children grow, but she became a grandmother, and then so life is about, we always talk about what is life, Kirti. You being a doctor and administrator, you have a lot of insight. What is it? We all have goals in life. We all have things. Nobody is immortal. How do you look at these things? Can you tell us a little bit? It's okay to use onco philosophy. Talk about it.
No, I agree completely with you, doctor. I think attitude is of prime importance. If you feel that you're going to die, there's no way one's going to survive. But if you feel you're going to get well, you're going to be up and about, you're going to be running marathons, you're going to be do whatever you were doing, I'm sure you will do it. And for myself personally, I feel that till the time I was crying and thinking that the why me question that I think Dr. Indra said, so the why me, why has it happened to me, and feeling sorry for myself, till that time, I don't think I started getting better. But the day I decided enough is enough, I have to now be positive, I have to fight. Even if there's a 10% chance of survival, I have to grab that 10%. It wasn't 10%. I'm just giving an example. So even if there's a sliver of chance of survival, one has to grab at it, and that is going to make a whole world of difference. And I feel family again is a big support. My family was extremely supportive. My little daughter was, very, very positive about the whole thing. It's not that she didn't understand what cancer was or what I was going through, but she didn't let me feel sorry for myself. She used to joke about my condition. She used to laugh about me losing. And she used to even, I mean, I have quoted this very often. She even used to give me the Nobel Prize. So, things like this. And that really helped a lot. And if I can just add to what Vandana said about the support group, I would just like to give an example because I was also one of the founder members of the group and I'm very proud of it. Once we were having a session and this young girl, she must have not have been more than 28, 29, with a little baby in her lap and wearing a headscarf, came and sat for that session. So she looked very young, and I was just wondering what is wrong with her. Has she gone to Tirupati or is she actually a patient? And then our eyes met, and I smiled at her, and she smiled back. And then later, after the session, no, before the session only, we started talking. And she started telling me that, she has this little child and she has breast cancer and she is hunting around for a wife for her husband. So I was very stunned. I said, "What is wrong with you? Why are you looking for a wife for your husband?" She said, "No, no, I am going to die and I need to ensure that the stepmother, he is going to remarry. So the stepmother should be very good to my child. So I will vet all the women first and then decide who he is going to marry." I said, "But you are not going to die. What rubbish are you talking? You're going to be absolutely fine." She said, "Nahi, nahi, mujhe," she spoke in Hindi. She said, "Mujhe cancer hai, main to mar jaungi." So I just told her, I scolded her. I said, "मुझे देखो, मैं तुम्हारे सामने खड़ी हूँ. तुम क्या बात बकवास कर रही हो?" And she looks at me and she says, "आपको कैंसर था?" I said, "Yes, हाँ मुझे था." And she just caught hold of my hand, Dr. Ajay, and she started crying and she said, "मुझे hope आ गया, मुझे hope आ गया, मुझे hope आ गया." She just kept repeating those words. And then she actually told me after that, "अब मैं husband के लिए wife नहीं ढूंढूंगी, अब मैं ठीक हो जाऊंगी." So I just wanted to tell you how, just being there, just showing that you are there and you've recovered can make such a lot of difference to people.
Oh, yes,
Okay,
that's what
you
we
bring
say
up
is
a, you
life
bring
is
up a,
10% of what happens to you
Yeah,
and 90% of how you react to it.
react to it. Yeah,
And nothing is impossible.
yeah,
Kirti, you bring up a very important point. Um, this aspect, how important it is, psychological counseling. You
yes,
know, we talk about patient to patient counseling, counseling by others, and the misinformation which goes out. And
yes,
one of the things as a doctor, and being in the civil service, I want you to comment is why even today the media, the information is only experts in passing on negative message, because they even call, even doctors in fact, use the terminology like cancer victims, talk about the palliative care. Indira actually, somebody would have considered her as a palliative care. 8 years on palliative care, nobody is on 8 years on palliative care.
yeah,
So when we treat diabetes, which is not curable, no doctor says, I'm going to give you palliative care for diabetes. No doctor says, I'm going to give you palliative care for asthma
yeah,
or blood pressure. But why is it, we as a community, even doctors, use this palliative business? There is a reason. In the past, people didn't do well. We didn't understand cancer. In fact, in my own journey in 1975, when I joined MD Anderson 1976, I saw people coming from all parts of the world, to the biggest cancer center in the world in Houston, MD Anderson, and people came as a last hope. But still, we didn't consider them as palliative care or victims. And I remember patients telling, "Do what is necessary, doctor, you learn from it." So terminology, you as a doctor, I would like your terminology sometimes I feel have caused more harm. and using hospice care. Imagine a patient is told you at stage 4 you need hospice care instead of treating the cause. They'll feel like your patient, what you said, I'm
Yeah.
already dead, even before dying.
Yeah.
So what can we do to change some of those thinking? And what, as a doctor, administrator, and a patient, what do you feel we should do? What is the message also?
I feel, Dr. Ajay, that things, even in these 13 years, I would disagree with you a little bit. Even in these 13 years, I see a lot of change in the way cancer is being talked about. 13 years ago, when I got it, people were not willing to come forward, not willing to talk about
Yeah.
their journeys. But now there are a lot of support groups like ours. There are a lot of people who are coming out and saying, I had cancer, I fought it. So I would not really agree that it's all negative. There are a lot of positive stories also that are coming out
Ah,
now.
there's definitely improvement,
Yeah.
but still I find doctors, people commenting palliative care, this which is sending,
Okay.
and even people are calling this patient was a cancer victim and all. How do we change the public perception overall? What is it?
It'll take time, and I think what you're doing is with support, with the support group, with otherwise with HCG, with your messages and your advertisements, and you're just your awareness campaigns. I think you're doing you. It's a step in the right direction. It's just that these are mindsets which are going to take time. It can't change overnight, so it'll take time. But like I said, I see a lot of difference in 13 years. So we are all going in the right direction, and I think we just have to continue doing what we are doing. More of such programs, more awareness campaigns. You know.
Yeah, this
I
awareness.
like other day I saw a patient who had a lump in the breast, who comes from educated family, who let it go for months together until it became a big ulcer because she was afraid to even tell her family, her husband, that she knew it could be cancer. She did a Google search and all, but then she kind of didn't come because she was afraid. Because some of these things are closely related to the social network and what kind of family they live in, because these people, some of them live in a joint family, some of them have pressures from their in-laws, this and all that. So I mean, this is a global phenomenon, obviously, but one good thing is, like you said, we used to see in around 2005 7, 72% of the patients used to come in the more advanced cases, like what Indra came. But now, nearly 70% come in early stages
That's
because
wonderful.
ambassadors like you, who have really conveyed the proper message. But obviously, still lot to work to do, because just recently I saw a patient in a tumor board where they had done a mastectomy, and our own one of our own centers, actually, the tier 2 city. But we have to I want you to comment on that also, big Vandana, and you, before I go to Indra. See, the concept of mastectomy, and doctors don't understand, the family don't. Psychological impact, can you talk a little bit about the mastectomy and psychological impact? Vandana, can you say, and then I'll ask Kirti.
Yeah, definitely it would have a lot of effect on the, because that's the main thing a woman has. She keeps her this thing for that. It is whatever said and done. When you go out, you like to dress up, you like to look nice, and that is one thing which, I mean, I would say that by itself, even if you would not bodily feel bad, but behind your back you would have that thing. Oh, I have lost my breast. How is it? What will somebody say? Will I be able to go out in public? How will somebody look at me? So I feel that that is very this thing. And as you said, doctor, nowadays without this thing, it can definitely be done. It's not necessary to give away the organ. So I think there, I should say, there is a lot of this thing. We have to have that thing that please do not undergo that, because mentally it does affect a person,
Yeah.
mentally and physically. Yes.
And it is something which is not even addressed, thought through by the doctors also. Unfortunately, doctors remove the organ breast without understanding the long-term implication. Kirti, can you comment? Because, we feel as doctor, I always felt, when we can preserve an organ, it's a great disservice. And sometimes people say, the family wanted. No, as doctors, we have to stand firm and advise the right thing. So what is your view, Kirti, on this?
No, like I said, I agree completely with you, doctor. If there's no need to remove it, one should not remove it. And I've also, during my counseling with other patients, I've also come across cases where women who've had mastectomies actually, like in amputation, there's this concept of phantom limb. I've also come across women who feel that the breast is still there, the phantom breast, and they even have pain there. So, that just shows the impact removing a breast has on the psyche of a woman. It's like losing any other body part, you know, even a little finger, losing a finger, would feel so horrible. So it's losing a big part of one's body. So if it can be avoided, it should definitely be
And
avoided.
in our own study, we showed significant number of spouses react in a different way post mastectomy. That
Yeah.
also is a major issue which nobody wants to talk about
Yes.
publicly.
Yes.
But
In,
it,
in fact, I should say that I think many women are not aware of this, that you can only have the lump removed and not the breast. Because, after I finished my treatment, and along with this HCG, there was this billboard which had my picture on it. Friends of mine who did not know that I have taken treatment were surprised to see me there. And they said, "What are you doing there on that HCG, this thing?" I said, "I have taken my treatment." They were shocked. Shocked is not the word. "So you mean to say you had cancer?" I said, "Yes." "So you mean to say you had the best breast removed?" I said, "No, I had the lump removed." "Is that possible?" I mean, this was about, you can say, about 6, 7 years back. People were not aware of that. So I had to actually tell them, no, this is how they do it, this is what they do, and this is what I have undergone. Then I met some other people who said, "But Vandana, since you've finished your treatment, why don't you just forget about it? Why do you want to tell people? You're there on the billboard. For what do you want to tell people that you've had the treatment and you had cancer? It's over, it's gone." I said, "Yes, it's gone. I agree. But I want to tell other people that if you have cancer, you're definitely going to be fine. You take your treatment and you're back out on the road." So this is what I think,
no,
that fear
yeah.
has to be removed.
Vandana, without ambassadors like you and advocates like you and Kirti, like what Kirti said, I don't think we would have made progress. It is this kind of information which is changing the approach to cancer, and we look at it. Coming to Dr. Professor Indra, I think one of the things, uh, Indra, which always people know, my own passion, as you know, is in advanced and recurrent tumors. Having trained in MD Anderson, and seen lot of breast cancer in various stages, living for long. I remember a case which was seen in one of my in my practice in 1980s. A patient came literally on a stretcher from a university hospital, told she's terminal. She was wife of a prominent politician, and they came and saying, "Can you do some palliative radiation?" I sat with them and talked to them and said, "Look, why don't you consider some form of, I have some chemotherapy drug she has not had, and is it possible we can give?" "Doctor, they said nothing can be done there at the university." I said, "Let us try this. Is there?" So we talked to them. One of the most important things, was spending time with the patient. It was easy for me to say, "Go and take radiation, be done." But I just spent time. I might have spent 2 hours with it. And to make it very short, she lived, when I left the place in year 2000, she was still living 10 years later. And the person, the politician, was from a different town, used to always write to me saying, "Happy holidays time." For a long time, he wrote me. Say, "My wife is now back working." So, here is a life would have been lost because of, either ignorance or not understanding the disease or not spending enough time. it is something which is so important, I feel, in advanced and recurrent tumor. So even Indra's case, if I can say, we spend a lot of time, and we put her on various form of immunotherapy, this and all that. So what I want to hear from Indra is, what is the message, Professor, you want to send for people with so-called advanced disease in breast cancer, and and your own example of doing good. You have beaten all the textbooks. No textbooks, I would say, somebody living for 8 years with breast cancer going to liver. So you've beaten all the textbooks, but it is because of your, of course, there is lot of talk about positive approach, how hormones play an important role. You've always been upbeat, like you said. I do more work now than I did before this disease. So, and accepting it, living and fighting and conquering it, what you have done. So what kind of people with this kind of disease, they feel that all the in this month, what kind of message would you like to send?
Okay. I'd like to say a few things. First is, one of the first lessons I learned in HCG was that all roads don't close at the same time. This was in one of my very, what shall I say, sad moments, which of course we go through all this. So I was told in one of the meetings, 10 roads are there in life. So one road might close, because there was a test that was scheduled for next day. I was worried. Nothing really happened. Everything came normal. But then the doctor whom I met that day said, don't get worried, because if one road closes, 10 will open. And I think that kind of talk helped me a lot. Yeah, initially I would also like to give this, one encounter I had with a taxi driver. I was going to Tumkur University, and they had sent a taxi. I got talking to him on the way. He said, I'm from Hassan, but my family I was here in Bangalore working, but my family shifted here because my father was diagnosed with cancer. So I said, what happened? Tell me. Then it happened that the father had taken treatment in HCG, and he was still undergoing treatment. So when he started talking about the doctors, the experience, he was telling me, we had to give up our land, etc., because Bangalore is expensive treatment medicine. When he was, sounding quite negative, in the sense that they didn't have those resources. Then when I told him, that I'm also, I took treatment in HCG, and then look at me, I said. He was surprised, like Dr. Kirti said, Vantanaji said, Nimuk bandita cancer. I said, howdu bandittu, nankene bandittu nodi anta. Then I was so touched when he said, Madam Nanga, now I have hope, because after seeing you and then going to this hospital and taking treatment and see how you're going now I think my father will live. And this, like this, there are people that I have met who have said. And initially, well, you told me that, well, don't have to undergo surgery. It was chemotherapy, then cyber knife. Immunotherapy you recommended, doctor. I will tell you, there were people who called me and said, what is this immunotherapy? It's not the standard treatment. So my policy is that I don't know about standard treatment. Ask me a question in sociology, I can tell you, but I'm not a doctor. So who am I? And and my family and I always said, what the doctor says is best for me. I will listen only to them and to nobody. In fact, I have come and gone for meetings, recordings directly from the hospital after taking immunotherapy, and I've been fine. And the other thing that I want to say is, when you gave me an opportunity to host that panel on Beyond Oncology in the Indian Cancer Congress 3 years ago, because you were talking about the language. In that panel, I was actually, I get very concerned about language, because once I remember telling at the HCG's reception counter, there was this gentleman, perfect. I know, I don't blame them, but the word is patient, which we generally use. The moment you hear that word, you get put off. So when I made this comment, there was this doctor on the panel from Bhubaneswar. He said he, heads that hospital, and I I think that day I was quite vocal, volatile, and I said the language is important and all that. But I was touched when he met me after the panel was over. He said, "Thank you very much." Because he said, "See, this thought of using alternate language, never come to me. For me, everybody was a patient." So he said, "Thank you for doing this. We will now think differently." And half of it is, yes, I will frankly say I was not ready to talk. But now I am ready. I have been talking, people call me. And I also would just like to quickly share that a cousin of mine, she is 80 plus, she's a doctor. And she came visiting India 2 years ago. I mean, like, she's given up practice now. She's been in the US literally all her life. And I was telling her this. She said, "What? Did you have cancer?" She said one thing. "Listen, as a doctor, I would never ever guess that you have gone through this. So your treatment, your approach, I mean, must be so good." She said, "Don't give up anything that your doctors are asking you to do. Don't take any decision on your own. This is the only advice I give." So yes, I agree. Lifestyle has changed. And of course, people talk, doctor. I also would like to tell you that one of the reasons why maybe people don't want to share it in public is there are two kinds of reactions. There are people who will tell you, "Oh, when we see you, we feel reassured." But there are also people who will spread, "Adagoito, your satte hogbitro." So I think it's very important to talk. I am writing, and that writing is going on and on. I'm doing it in Kannada because I wanted to. In fact, somebody asked me, "Kottira, we will publish it as bring it out in a series," but it's not come to that shape. But definitely, I'm going to write and share and do this. I hope I've said.
Before I
Hmm.
thanks, Sindra. Before we ask for any final comments, I just want to take few minutes to really share that in 45 years of cancer care, half the time in US, half in India, I have met some remarkable people. And I think as a doctor, what I learned taking care of cancer patients is a lot more honestly than what I have given to them. I think the incidents where cancer patients have consoled me, at the time when I used to cry with my patients a lot, they're making rounds, seeing patients. But I feel what I learned about life, the philosophy, I call it the onco philosophy, and how will a patient who knows that they may not live long still can have a big smile. And I remember, even Professor Indra, I never remember her without a big smile, even when she took it like that. There are people who know something could go wrong, who are positive, but even if something goes wrong, they remain always positive to the end. And I learn a lot from that. And I want all our doctor community, the public at large, to learn from the experiences of the patients. For me, honestly, I am an oncologist. I see people with cancer. I treat people with cancer. I do everything, but I have not experienced cancer. You know, it is not as good as experiencing cancer yourself. So really, the message is very clear. When you experience cancer, when you go through that journey, it's a lot different. And when you share that journey with others, that is when there is validity to that. Whatever we say is based on just feedback from others, whereas you are actually giving an authentic report on what it is. So it is great what you all have said. And I just want to know in the remaining few minutes, do you, Vandana, you want to make any final comments on this month?
Yeah, I would say that, see, cancer is it's about multiplying of the cells. So it is the cells in your body react to everything that what your mind says. And a negative mind will never give you a positive life. So talk to your body, talk to yourself, and have that think that, yes, I am going to be perfectly all right. Love your body, love yourself, live in peace and harmony with yourself. That is what I would like to say. And of course, be aware of your physical body, because that's a beautiful gift which the Almighty has given you. So respect and honor your body, live in peace and joy, talk to yourself, talk to your body, and I think yoga gives you a lot of. I would definitely say that I have been doing yoga and pranayam, and which has really made me comfortable. So I always say, take a deep breath in and take a deep breath out. Love yourself, live in peace and harmony. That is
Thank
what I.
you. Kirti?
Dr. Ajit, taking off from what Vandana said, I just like to say that early detection is of prime importance, utmost importance. So please understand one's body. Do not neglect any symptoms. Anything, please get checkups done regularly. And don't be worried. If it's cancer, it can be treated. So the most important part, I'll sign off now with this one sentence, that the most important part of cancer is CAN. The CAN is the most important part of cancer. Thank
Good.
you.
Thanks, Kirti. So, Indra?
Yeah, all I want to say is it's very important to accept that you have it. I remember the first time when I met you in HCG, you asked me this question: why are you not asking me any questions? Yes, it has come. I accept it and will do my best to fight it. And the other thing is, I think it's very important to keep control over ourselves, lifestyle, listen to the doctor, and not ignore anything and take anything lightly. And of course, keep on doing what you are doing. That's very important. Many people get disheartened. I know, I feel very sad to say this, but a very senior colleague in my own profession, who was very hale and healthy, but all of a sudden this came. Probably it was not detected. And it's sad that such a brilliant scholar like him, within 15 days he was gone, because people told him all kinds of things. He said, cancer, I'm not going to survive. So I think all I would like to sign off by saying that it is very important, and the doctors talking like this, because I know what I love talking. And then it's for us, like I already, as I said that day, for me, my case may be important, like that each one of us feels, and we bother you. But I think it's very important that you make us feel so comfortable. And I always like it when I see you, the kind of importance you give. At that moment, I am there, doctor, you are there. And I think that goes a long way in making somebody who is going through this feel very important. And always I have seen you in the believer in talking, the consultative approach. And I think that goes a long way in making us feel. And I always would like to be part of what HCG wants to do in this direction, because Pink Hope, I have, of course, come once or twice, but since I live outside, I'm not able to make it. Thank you very much.
Thanks, everyone. I think we have heard from three remarkable people, and I hope we will continue this journey, do more of these things. I just want to close by saying today we did not touch a lot on the lifestyle disease. I know cancer is a lifestyle disease. I know, like what Kirti said, lot of prevention, mind, body. There are a lot of things were really important. Obesity is the number one cause of cancer, particularly breast cancer, and genomics plays an important role. I know I didn't want to touch on all that because we will keep it for another day. Obviously, we need another conversation on all. We can't do everything in one day. So I think today the message is very clear, loud and clear, that how we should approach cancer. The big C, I think, as Kirti said, can. And as Vandana said, how positive approach is important, and what Indra said about taking it in strides and facing it, and continue to do what you believe in and continue with leading a normal life. I think this has been a remarkable hour. And once again, I thank you all for consenting and being part of this journey.
Pleasure.
For me, and every time even though I'm 45 years in oncology, every time I interact with patients, the remarkable thinking, remarkable food for thought, and what next we can do. So it's a great learning for me also. Thank you very much, everyone. Thanks for
Thank you,
Thank
Doctor.
you. Thank you, doctor.
Thank you, HCG, for giving us this
Yeah,
platform.
thank you for this
Thank
opportunity.
you.
No,
Yeah.
no, we will do a lot more as we go forward.
Yeah.